Hi, Doc Davis, spine specialist, orthopedic surgeon. Today we're going to talk about 5 reasons why you might need spine surgery. One reason you may be recommended to have spine surgery is if you have weakness. Sometimes patients will get weakness such as a foot drop, where they can't pick their foot up and down, or they'll have weakness in their hand muscles where they'll drop something. And those are a couple reasons why surgery might be the first treatment recommendation. The explanation for the weakness is that the nerve that controls the muscle, either to your foot or your hand, has been compromised and isn't working normally. Another reason that you may consider spine surgery is if you have numbness. It's not uncommon to get numbness when a nerve is pinched in the neck or the back, and that can either reduce or completely eliminate all sensation along the pathway of the nerve. A patient might describe numbness or tingling on the bottom of their foot or part of their hand that they can't feel, and sometimes they'll be prone to burning their hand or getting a cut and not knowing it. In these cases, surgery to take pressure off a nerve in either the neck or the back can be helpful to try to restore neurologic function. Frequently, I'll see a patient who comes to me with numbness in their hand or tingling in their foot, and the problem is actually coming from their spine. Many times that patient has seen people to evaluate for a hand problem or a foot problem, when in fact the origin of the problem is in their back or their neck. The spinal column in nervous system is like an electrical grid, and so if there's dysfunction in the nerve in the back, it can send a signal of pain, numbness, or tingling anywhere along the course of that nerve, from where it exits out the back of the neck all the way down to the finger or toe. Another reason why you might be recommended spine surgery is if you are having issues with your balance or coordination. In some instances, when there's pressure on the spinal cord from either a disc herniation or a bone spur, it can cause neurologic deterioration. You can think of the spinal cord in electrical terms like the master circuit on a circuit board in your house. And if there's a problem with that master circuit, you can run into a lot of different issues. And that's what we see with pressure on the spinal cord, resulting in issues such as loss of balance, loss of coordination, and even sometimes bowel or bladder problems. Speaking about bladder problems or even bowel problems, in more severe cases, if there's significant pressure on the spinal cord or nerve roots, you may find that you have problems going to the bathroom, either not being able to start to go to the bathroom or not being able to control it. In those situations, that's an emergency that needs to be evaluated immediately. Keep in mind that this is exceedingly rare, much less than 1% problem. The most common reason why I'll recommend surgery to a patient is someone who's experiencing severe pain. Nerve pain can be quite debilitating and challenging to live with. It's kind of like having 10 toothaches all at one time. In the case where a patient has severe pain and there's no other way to control their pain and keep them comfortable, spine surgery can make a profound difference in a lot of situations. If you enjoy this video, please give it a like or subscribe below. If you have any questions regarding spine surgery or recommendations that you've been given for spine surgery, feel free to drop a comment below and I'll get back to you. I'm Doc Davis, spine specialist and orthopedic surgeon. I've got your back.